Welcome to Reflections, a program where we discuss values and virtues for the transformation of the individual and the society in general. I am Father George Ehusani, and I have with me in the studio once again Professor Titus Ibekwe. Prof, you're welcome to the studio.
Thank you, Father,
I used to do this almost by second nature, but now I'm learning.
Yeah, we have to learn
social distancing.
Yes, it's very important.
In the era of COVID-19, Professor Titus Ibekwe is Professor of Otorhinolaryngology, ENT, head and neck. He is also a public health professional. He is the chairman of the National Body of Continuing Education for Doctors, for the Medical Association. And as I said, he's of the Faculty of Medicine, University of Abuja. Prof, you are welcome once again to the studio. We discussed in the first segment, we discussed about COVID-19, the nature of the virus, the kind of strains that we may be seeing in our environment. We also discussed about treatment and the fact that there is no treatment, but perhaps the best approach in the meantime is prevention. I am concerned about the news of doctors that are falling victims, nurses that are falling victims, health professionals that are getting infected with COVID-19. First of all, let me ask you, each time you watch TV and you hear of even one doctor dying on account of trying to treat people and dying, how do you feel?
But it is a precarious situation, I would say. Without sounding emotional here, the reality is that it takes a lot to train a doctor and indeed to train any health professional. And it's not something that every life is very important.
Yeah, but the one who is to take care of others.
Who are to take care of others, you know. These are the lifesavers now falling victim on daily basis. These are the frontliners. It's just like you have soldiers who are meant to protect the rest of the country.
Dying.
And they are dying.
And not just soldiers, captains and majors.
Thank you. So it is a very painful situation. It is something that nobody wants to happen. Nobody likes seeing it happen. And we're calling that everything possible should be done in order to curtail this, to take it to the barest minimum and possibly completely prevent it, because we need them. We need them to keep alive.
Just further on what you are saying, it is said that the UN WHO recommendation for the proportion of doctors per population is something like what?
1 to 600.
1 to 600.
Today we have 1 to 6,000 in the country.
Good. So if one doctor dies, if one nurse dies, if one whatever dies, what it means is that whereas we should have 1 to 600 and we have 1 to 6,000, then what it means is that we may be going to 1 to 12,000 if we do not. So all of us have a responsibility to see that the doctors and the health workers are protected.
Absolutely. Absolutely. These are a group of people that I call in my own language the geese that lay the golden egg, because they are so precious, they are so important, especially in the fights that we are fighting currently, that everything should be done. First, in protecting them with even the environment that they are working. All right. Do you have the adequate protective material? The minimal standard has been recommended, which they can use when they are treating those perceived ill patients, and even those that are not ill. Because the problem here is that it's not written on the face. Even some carriers that may come to the hospital for treatment of other ailments are asymptomatic, and they can transmit this disease. Not to talk of people that belong to my own field, like the ENT surgeons.
And you look into people.
We live and wake up from the nose and throat on daily basis. You know, so indeed every health worker is at risk. That's why requesting that effort should be made to ensure that these personal protective, equipments are made available and should not lack at any point in time. Then secondly, minimum is that you should have a life insurance cover on each of your health workers. It's not a luxury.
I thought recently there was some announcement of some package, some risk allowance. I can't remember what it was. Some risk allowance for medical workers.
Father, it is on paper. There's nothing concrete yet. And it is not a one-off thing. It should be something that is
and it is not supposed to just be crisis time.
Yes,
it's supposed to be
it's
there.
Something that should be there, something that should be worked upon. So the health insurance cover, life insurance, should be mandatory for every health worker. And of course, you talk of these allowances that you have mentioned. Currently, we are talking of 5,000 naira as the so-called
duty allowance.
Hazard allowance.
Hazard allowance.
5,000
naira
per month. That is what it is.
I mean,
which is so ridiculous.
Ridiculous.
So if we draw some analogy, currently Ghana made a review of their own system, and as I'm speaking to you, Father, what is used for life insurance cover on every medical doctor and they cascaded down to the health professionals in Ghana is in the tune of 20 million naira. That's the equivalent of their Ghanaian cedis, per medical worker, 20 million. And they went a step further to decide to increase their salary by 50%. And they also made a pronouncement that it should be tax-free, all the medical allowances that has been paid for. But all these things will not bring life back, but at least it gives some sense of belonging. Very importantly,
some sense of appreciation, that there's an appreciation.
Absolutely.
As you know, a few days before, I had to send on behalf of my organization, Terra and Islamic Education Trust, send an appreciation to doctors and medical workers and so on, because, okay, I am not able to buy you PPE, I'm not able to improve your working circumstance, but I say a big thank you for the work that you are doing. Because I look at the thousands of trained doctors, including those that have done the consultancy programs, who have emigrated, who have left the country to different parts of the world, and who are doing very well, and using the resources that we have used here to train them, they need to help people in other parts of the world. In fact, a few of them are said to have died on account of this COVID-19, helping people in other parts of the world. Now, it's an ugly situation whereby a poor country trains medical professionals and exports them
to migrate.
And the reason is that for many of them, they are not appreciated in this country. So, what could, let's say, you were very active in Nigeria Medical Association. You were former vice chairman.
Vice president.
Vice president. Now, what can a group like Nigeria Medical Association, in collaboration with all the allied associations that take care of the sick, what can you people do to continue to mount pressure? And I must say, involve the rest of us, civil society, because it's not something you should do alone. We shouldn't abandon that to medical association.
That's right.
To keep making the government and agencies that are responsible recognize that we are going to lose a lot if we do not appreciate this segment of the economy.
It is a collective responsibility, Father. I can tell you that the medical association and the pressure groups that are doing their own bit of the job. And, in life, everything is scientifically based nowadays. When you talk of any reference system you want to bring on table, you should be able to make it a world class. You must be able to, point at references where people can cross-check. So the medical association, they've sat down, they've articulated, impacted the health sector in Nigeria as it is. They've went ahead to identify where the problems lie. Okay, all these are fully documented and they're there. They're public-led, also there for the government to see. So all that is needed is for us to have a change of heart, for us to realize that we only have now to do it. That's why somewhat, as I said, in some adverse situations, it turns out to be an advantage. Because this disease is actually a second chance, disease.
Second chance for the country to rejig its healthcare.
The entire system, to sit down and reevaluate ourselves. How have we fared? Because it has exposed a lot of things. It has shown us our weaknesses all around.
What did you call it? Equal opportunity?
It is an equal opportunity disease.
Sickness.
Because in the real sense of
that COVID-19 is an equal opportunity disease. So we need to work towards equal opportunity in healthcare in this country.
Absolutely. Absolutely. So, because this disease, it doesn't spare anybody. And interestingly, even your riches may not save you at this point in time, because you must stay back and receive medical care where you belong. There's even no opportunity to travel out and go to anywhere. Even the developed countries, they are struggling. Yes. And there are even situations in some of the developed countries are even worse off than what we have here in our country. Yeah. So it is a wake-up call that we should do the needful, invest, massively into the health sector to ensure that we'll bring our healthcare system to an appreciable level. Every portable and good enough.
Every crisis can be seen as a dangerous opportunity. So the crisis of COVID-19, the coronavirus pandemic, as you are saying, can be a wonderful opportunity for Nigeria to lay out new policy guidelines for the transformation of the entire health system. That's right. From the cottage clinic in the village health centers to the teaching hospitals,
to the quaternary centers.
So this is an opportunity. The rich in this country who have always gone overseas for health treatment, today it is not even in their interest. I mean, you go from where 12 people have died to where
the opportunity is not even there.
It is not in their interest, even if the opportunities were there. So it means, but something surprising. This equal opportunities disease that you talk about, we have Lassa fever, still killing people this year. Right. This year alone, we have almost 190 people have died of Lassa fever. Somebody said, how come that we have been crying about Lassa fever? 1 or 2 doctors have died in Nigeria of Lassa fever, but nobody donated anything.
Several doctors.
Now that some big people are infected with coronavirus, then we started seeing the billions. Okay, that's good. So from that point of view, coronavirus is a blessing. Let these donations continue and let them be channeled towards building of our health system. I mean, I have a problem with distributing cash on the road, on the streets. I wish those billions were used immediately to revamp the health sector and put the infrastructures in place. Because if you start distributing money, every Nigerian will come out to collect whatever. And at the end of the day, you will tell us that you have spent 10 billion, 100 billion, and we won't see anything that has come out of it. Whereas, if you went to put an intensive care unit in my village hospital, you can see it. You will be able to see it. 5 years after, you can see it there. So clearly, I am really concerned, like you, I'm really concerned about the welfare and the safety of medical workers. I mean, my sister and my niece are medical workers, are part of it. And so I am quite concerned. What advice do you have under our constrained circumstances? What advice do you have for hospital management teams and for your colleagues, really? I mean, there are some of your colleagues who watch our program. While doing what they are called to do, some care. I mean, in recent times we heard about maybe they are not alive to explain what happened, maybe taking care of patients privately and falling victim to the coronavirus. And what advice do you have for your colleagues, medical workers, to be careful while discharging their duties conscientiously?
Well, Father, it's a very complex situation because any trained medical personnel is somebody who has empathy, and sometimes emotion can even drive you beyond reasoning. You see somebody who is dying and you feel that you have something to offer, and unfortunately the system does not support you to even protect yourself enough. It becomes a matter of struggling with your conscience and to be able to reel out what actually science tells you, that going into this, I stand a very big risk of getting infected because possibly I don't have all that is needed to do that. But that is where it should not be left for the medical personnel alone, because we all love our life. And for us to be able to save many more lives, we should be alive today to save many more tomorrow.
So the authorities?
Yeah, the authorities, they have a lot of responsibility. both social, both psychological, and the ones that will be pricking on consciences, to make sure that things are done rightly as much as possible. We know that there are limited resources. We cannot have it all rosy. But yes, with the effort being put in, we should be able at this point in time to be able to, prioritize. Prioritization is the word. Channel this, deny ourselves of some of these luxuries and push it into the healthcare system. So that those who are in this forefront fighting will have the minimum of what they need to do this work. I keep on saying that the problem is not the healthcare workers, because they are ready to give in 120% of their effort to make sure that we'll roll back this disease and win this war. But the problem is the support, the things that they need to work with. Are they really available? That's why I've written in some of my publications, I was asking for those who are making donations, please, as much as possible, if you have direct connections to the manufacturers that you can get this equipment, get these things and ship it in. Stop giving us money. Because I am not accusing anybody in any way, but what we need is that the bureaucratic bottleneck in harnessing these your donations together, arranging them how they're supposed to be, looking for companies where it will be channeled to in order to, request or put across, orders for these materials, they are time wasting, and every second really matters. So those who have direct access to us getting equipment that will help us in fighting this disease, please do that. It is preferable to just donate cash into the system. And on the part of the authorities, they should try, irrespective of how difficult they are finding things. They should just remain focused. And blueprint of what we need to do is already there. We have said minimum we should have a functional test center in at least one in every state. Because the more we test, the more we'll be able to identify those who really need
Right now we have about 5 or...
No, we have minimum of 7 now in the country. And others are coming up, but they are not really activated or functional. But we need minimum of 1 per state, Father, in order to be able to. Because time is of essence. These things should be very functional. You take samples, and so that within a very short time, you'll be able to turn out results. Because if you take samples and they have to stay for up to 1 week before the result comes, and the patient is there,
is dying,
is also mingling with other people and infecting so many other people. So turnover time we have to aim at, which is what this NCDC, what they're aiming at, to make sure that every result should come out within that same day, 24 hours at a phase. And in every state, we should have a test center. In as much as we are trying to scale up effort and scale up this, it has to be qualitative care. And we should be sure of what we are doing at any point in time. That quality care and quality control should also be engaged and make sure that it is on the table. And this should not be left for the federal government alone.
Agencies,
the state
companies,
government,
local government, yes.
Indeed, each and every one of us, we should see it as a collective fight.
Very important point, Prof, that because you see, a lot of what many of us have watched on TV in the discussion about healthcare and COVID-19 has been focused on the federal government. But the resources of Nigeria are both federal, state, and local government, but also companies. Companies sometimes are getting unusual percentages of national wealth. So they should contribute for their own good. Because if the country, like now, if the country is paralyzed, then they can't function.
That's right.
So for their own good, they should contribute to this thing. While you were speaking earlier, you mentioned about the welfare of doctors. You mentioned not only their safety, and so you also mentioned the psychological. Is there anything in place, or are there any mechanisms in place for the psychological care of medical workers across the board? Because that appears to be one area that is not sufficiently emphasized in this society, the psychological welfare of people who bear the burdens, during emergencies like this. Like I said somewhere, I saw a doctor on TV in New York who was weeping. He had worked for weeks on end, and from morning to night, hardly having time to eat, only to be seen that so many of the patients, a large percentage of the patients, are dying and have to be taken to the mortuary. you could see that this doctor was distressed.
Yeah.
You could see he was running towards depression. What kind of mechanisms do we have in our society to support the medical workers who are on the front line of this fight?
Father, the point you have raised is very important. And it's also pertinent to remind each and every one of us that before we became anything that we are today, first we are human. These doctors, they're not superhuman.
They are human
beings. All right? They also have responsibilities. They feel what other people feel. And yet, as it is today, everybody is being asked to stay back at home, except for the
Doctors cannot stay
personnel.
at home.
Doctors, nurses, pharmacists, and the rest of the team. So they are there, fighting non-stop. So the support is very, very important. And how can we do this? There are tangible and intangible way of giving support. Part of what we are doing now is morale booster, is building the psychology of people appreciating what people are doing. But beyond appreciation, we still have to go a step forward. Can you give them that sense of belonging that even if anything happened to them while fighting in this forefront, that their family out there
are not going to be neglected?
They're not going to suffer. If you are fighting such a war and you know that there is a backup, even if anything happens,
you can put your whole heart.
Yes, you put your heart there. Then secondly, there's even some scientific things that are coming up, which you have been talking about. Largely and basically, the test that is being done now for COVID is we test for, the virus directly. We're talking of PCR tests, where we take swab from the nose and the throat. But serology test is coming up and very, very strong, thereby testing the level of antibodies. These antibodies give you an idea of level of protection that each and every one of us has. So we are saying that this should be mandatory for all healthcare workers. When you do their serology test and you know their level of
then you know
immunity,
who can be exposed.
Thank you. So you will be able to triage them. That is, you arrange them at
according
the level
to
of immunities. And those who have very strong level of immunity, you put them at very actively infected people where they are taken care of. Let them stay there and take care of them. They will be there and they will psychologically,
recognizing that they do have, they can see the scientific evidence.
Yeah. Whereas those who have, very low
compromised
level of
or
immunity,
something,
put them as second liners out there behind, By so doing, we'll reduce unnecessary risk and exposure that we're expecting the medical personnel to. And the idea of calling those that have gone on retirement to come back and help should not be an option. You know what? Retirement age is 60 and above. And these are the age group that are largely susceptible to the virus. And you are calling them to come back. What kind of inducement are you are giving them?
That's an
it's
important
like
point.
Almost a death sentence. So all we should do is to protect those who are actively working in the system. Make sure that they are protected so that there will be little or no casualty among them. Give them the morale booster, give them the psychological support that they need so that they will carry on doing this work.
So,
and beyond this, Father,
yes.
Sorry for cutting, beyond this, it takes two to tango. We say that this is a disease of nature and nurture. You must nurture everybody that is involved in this fight.
Yes.
Even the populace, whom you ask to stay back at home.
Provide some basics for them.
Succor that will make them to abide by these rules and regulations that we roll out on a daily basis that will help us to fight back. So it has to be a holistic thing.
I mean, I watch on TV, let's say in the UK, how doctors are so busy taking care of the sick that they have no time to go look for a restaurant to eat. So charity agencies and individuals prepare food that they bring to the hospital so that the doctors can come and eat. Fantastic. Nurture. So we need to do all we can to support those who are on the front line to be able to do their work. And those who are asked to stay at home, government, agencies, individuals must do whatever we can to support people, especially the weak, who are to stay at home and who cannot go look for their daily bread. On that note, we will bring this segment to an end. I have been speaking with Professor Titus Ibekwe, Professor of Otorhinolaryngology of the University of Abuja, who we've been discussing COVID-19 and its implications for medical workers, particularly the safety and welfare of medical workers. We pray that, as you said, that this COVID-19 will be a watershed. It will be a catalyst for the revamping of medical care in this country. Thank you. God bless you.
Thank you very much.
Hey, I cannot shake you again. God bless you.
Thank you for that.
Good.